Hi, Paul Slakis, Good News Planet. I'm speaking to Dr. Larry Sperling, cardiologist, executive director of the CDC Million Hearts Initiative. Hi, how are you doing today?
I'm doing well, Paul. Thanks for the chance to speak with your listeners today.
Great. 41% of U.S. adults have delayed or avoided medical care during COVID pandemic, and Dr. Sperling's with the well, I would say you're in a hot seat over there with the CDC. That's a difficult scenario to be in, but a great scenario because you guys have helped us work through this, and hopefully we'll continue to only get better here. So what are some of the things that this Million Hearts Initiative is doing?
Yeah, so thanks for asking. The Million Hearts Initiative is a national initiative. It's co-led by the CDC and the Centers for Medicaid and Medicare Services. It's a national initiative focused on preventing 1 million heart attacks, strokes, and cardiovascular events in our nation. And you mentioned the importance of getting back on track related to the health consequences of the past 18 months or more now. We do know that there's been a significant delay and avoidance in medical care, and this has led to an increase in deaths from heart disease and stroke in 2020. This delay and avoidance of medical care has led to adverse outcomes with an increased risk for cardiovascular disease, and it is time for Americans to get back on track as we roll into the holidays and the new year.
Let me ask a quick question, I guess. CDC Foundation, is that different than the CDC that, we see on television every 5 minutes talking about this medicine and that medicine?
The CDC Foundation is a specific branch of the CDC focused on connecting to campaigns, for instance. This national campaign that is being launched is a CDC Foundation campaign in partnership with Million Hearts. And this campaign is reminding Americans to take small steps getting back into a focus on their health. The Start Small, Live Big campaign focuses on older adults who make up the majority of individuals with cardiovascular disease, and this campaign encourages adults to get back on track with these small steps, like scheduling their medical appointments, getting active, and eating healthy so they can get back to living big. So the CDC Foundation does work along with the CDC, but with a very specific focus.
Is the Million Hearts an organization also, or is your organization?
Yeah, Million Hearts is not, we wouldn't call it an organization, but it is a national initiative. It was intentionally started a decade ago with the explicit focus on preventing heart attacks, strokes, and cardiovascular events in our nation. It's a co-led initiative by CDC and CMS, and Million Hearts works across all 50 states. We work through partners, both private partners and federal partners, and we certainly appreciate all of the dedication and commitment of our partners who are trying to get our American population back on track right now regarding their health and regarding a focus on heart disease and stroke prevention.
Well, what are some of the things that someone can do? I mean, for those that have gotten vaccinated, this is such a stressful time, has been, and what are some things that people should keep in mind so they don't get heart or stroke?
Yeah, thank you for asking. It absolutely has been a stressful time with significant consequences, and so it's time to connect back with your doctor or medical professional. When you do so, you want to be prepared. You want to have questions ready related to your general preventive health, chronic disease risk factors, and the current trends. So an example of some of these questions might be, based upon my age and health status, what are the risk factors I should be focusing on? What are the tests and screenings I should be getting and how frequently? Are there vaccines I should be getting to stay healthy? What should I know about my family health history? What are those small steps and lifestyle changes that you would recommend for better health? You absolutely want to ask the question, am I at risk for heart disease or stroke? How do I measure or know what my blood pressure is, my cholesterol is, my blood sugar? And then should I be considering prescription medications to manage my risk factors for heart disease?
Okay, very, very good advice. That's Sperling. Let me ask you, because I was involved with the Brain series for PBS back in the early 80s, the first major 10-part series. And somehow I recollect way back then that getting to the stress word again, how stress actually clogs your heart up, the arteries, adrenaline. Is that so still?
It is still very much scientifically founded. So stress, both acute stress, can impact the heart and the blood vessels, and so can chronic stress. And we know that stress, anxiety, and depression are important factors that relate to the risk for heart disease, just like having high blood pressure, being a smoker, having diabetes, or having high cholesterol. So this is a time to talk to your doctor or medical professional about the stress that might be impacting your life and affecting your overall health.
And even a therapist at a time like this. I mean, there's been a lot of people who are depressed during this last 18 months, let's call it. You know, as a result of changed lifestyle, living in their own home, gaining a lot of weight. Everybody says, I got my 25 pounds. And so, you know, these are very, very, probably will also lead to potential heart attack, right? I mean, this is serious stuff.
This is serious stuff. There have been significant impacts of this pandemic over the past 18 months or more. And so for each and every one of your listeners, it is time to get back on track. It's time to refocus on your health. And it is time to understand that heart disease remains the number one cause of death in our nation. And so we must get focused back with these small steps. And with these small steps, we can improve our health and get back to living big.
Two last questions. I will emphasize, as you said, get to that doctor, get some blood tests, check your blood pressure, your cholesterol. Those are very wise and should be at least annually. Wouldn't you say, Dr. Sperling?
Certainly, for those older individuals, those at increased risk for heart disease, or those living with heart disease, annual evaluations would be very important. There are many that have not seen their doctor or medical professional now for several years. So it is time to reach out. It is time to reconnect, and it is time to refocus.
What's the website? Is there a website that we can send people to? Thank you.
Yes, certainly. So the website for this campaign is hearthealthysteps.org. With this website, you can learn more about the small steps you can take to live a heart-healthy life.
Fantastic. Okay, Dr. Sperling, thank you very much. The CDC is very important for our country and has really done a great job and has for very many years. So we appreciate, and I appreciate that you're a cardiologist. It's very important. Thank you.
Thank you again, Paul, and appreciate the opportunity to speak with your listeners today.
Okay, we will continue on here. Thank you, Dr. Sperling.